So now we're going to look at the clinical application. So we went through some of the principles behind how and why we use the different thermal modalities. Now we're going to look at the actual clinical applications. Again, also kind of discussing, again, at times, some of the evidence behind our use of these different modalities. So we're going to start with cryotherapy. Again, the primary purpose when you really look at cryotherapy is really pain relief. So we know that as a part of our early rehabilitation plans, that's always going to be one of our early goals that we're going to want to look to do. We'll discuss a little bit about, because obviously there's going to be some crossover between cold and heat, and we'll get into why you would pick one over the other in making your selection. So our primary purpose is going to be pain relief. You've heard a lot of the mnemonics. The old mnemonic used to be RICE, rest, ice, compression, elevation. Went from that to PRICE, which also included protection, RICE, ice, compression, and elevation. And now we moved to what we call POLICE, which is protection, optimal loading, which I think is one of the key things in regards to rehabilitation, is optimal loading, ice, compression, and elevation. So optimal loading is, again, just loading the tissue so that it can repair, but you're not actually continually damaging it. So if you remember going through the healing process, we mentioned how the tissue has to repair and remodel. So sometimes, when you kind of overly protect the tissue and you limit some of the early motion when you don't really need to, you can actually cause some, do more harm than good. So the idea is we want to do some optimal loading, and we'll talk about kind of what that means in class a little bit. If you have questions, we can kind of go through that. But that's an important part of all of this. So there's little evidence to show that ice facilitates quicker recovery. Now, empirically, we use it for pain control. There has been some benefits of pain control, but we're going to talk about some of the ways that we use it. It's important to note again that it was commonly thought of in the past that, well, we apply ice to reduce inflammation. And again, if ice truly reduced inflammation, we would be essentially limiting the healing process. As you recall, we said that the inflammatory process is important for healing. So the other thing is they'll sometimes say, well, ice eliminates swelling, eliminates edema, and that's also not true. It can limit edema and swelling. Okay, so it's important to note that, and we'll discuss that. And again, it's in combination. You have to also use compression and elevation. So compression and elevation also limit the extent to which swelling can develop. Okay, so compression will actually oppose arterial hydrostatic pressure. So we talked about the difference between hydrostatic and osmotic pressure. So compression will kind of oppose the arterial hydrostatic pressure, or the force that's pushing the plasma out of the circulation. Compression can also limit the osmotic pressure to a degree, because it will limit the amount of space that will allow swelling to form. And elevation is also going to decrease both arterial and capillary hydrostatic pressure, and will also oppose the development of swelling. And that will also, elevation will also reduce swelling. However, typically once the body part goes back into the gravity-dependent position, obviously some of the swelling will eventually return. So you see that in ankle sprains. If the person stays elevated, the swelling will go down. However, when their extremity goes back into that gravity-dependent position, it will start to form again, and sometimes it's very difficult to get that swelling out. So again, we had mentioned how, even though the data is limited on pain relief, we do know from, empirically we use ice to relieve pain. And we do know that there is an effect on the nervous system structures to help in relieving pain. So it's going to come from reducing nociceptive information. So you have to look at the origins of the nociceptive signals, so where it's coming from. So the idea is that we can reduce pain, one, by slowing the activity of the A, delta, and C fibers, and also through the stimulation of the periaqueductal gray area are going to be two ways in which that the cryotherapy will kind of limit the amount of pain that the individual is experiencing. As far as some of the particular units, so a thing of note, so it's very popular to use the cold water circulating units. You may see some of these things. They're, the Game Ready is one of the more common ones used. They get utilized because they can be applied for a prolonged period of time. It's very common to apply these after surgeries. And, for the most part, they have found that they help reduce the use of pain medications, which is obviously good. So we do know that there is some benefit, but again, we just need some further research to look at the cost versus the benefits of these various units. So we had discussed arthrogenic muscle inhibition. So, a lot of times what we have with these injuries is that you get this decrease or an inhibition in the motor neuron pool that prevents the person from fully activating muscles. And commonly, this happens due to the swelling that occurs. So when you have swelling in a joint, what that essentially does is it's going to disrupt the proprioception, the neural input, which then therefore is going to have this reflexive response by limiting the motor pool of the muscles in and around the region that it could actually activate. So it's really important that when you have that swelling, that this could become an issue, so that you again kind of limit the effects from that. Muscle spasm is also going to contribute to the dysfunction that you have. So when when a joint gets injured, the body senses that there's going to be some basically tightening. The muscles will go into spasm and guard just to protect the area. So again, this could further impact your tissue repair. So all that swelling, pain, spasm. So we know in discussing the orthopedic injury model that all of these different things in their own way could kind of inhibit or basically slow down tissue repair. So by limiting these effects, we know that we can possibly hasten the recovery, allow the recovery to happen a little bit faster. The person's still going to have to go through the different stages of healing, but it's going to be important in kind of expediting that. The other thing is arthrogenic muscle inhibition is linked to early onset joint osteoarthritis. So individuals who, if they've had injuries to a joint, particularly repeatedly, and experience this, there's, stagnation that could occur in their movement. They could possibly develop, again, long-term joint damage. So if again, the idea is restoring movement as early as you can, you could, just increase the structural strength of the ligaments. You could increase collagen synthesis in the tendons around the region, and increase the health of the articular cartilage. So when articular cartilage isn't stimulated with movement, it tends to break down. So again, getting the person through with range of motion and limiting the effects of this is very important. So when we look at arthrogenic muscle inhibition in injuries, so cryotherapy we know may diminish the effects of arthrogenic muscle inhibition. We had talked about this earlier in the principles chapter. So again, we want to look to restore range of motion. Restoring range of motion is going to engage the lymphatic system, so that immediately is going to assist with the removal of swelling, and it's also going to enhance capillary exchange, which that'll also assist with the healing process. So, again, applying cryotherapy, we think, one, can help reestablish that motor pool. And cryotherapy also has what's called the disinhibitory effect, because of the fact you're going to be reducing pain, that the cryotherapy can possibly increase range of motion or the muscle contractions that could help aid in kind of restoring this function. So we typically observe this with knee and ankle injuries, are probably the two areas where we deal with this the most. So, again, your various sprains to these joints, again, the earlier we can restore range of motion and get the person moving, that comes back to that optimal loading perspective, we can kind of gain more with them. Now, interesting note, and so not all patients will develop this. So again, it comes down to, do you necessarily have to always apply kind of a, menu-driven or cookbook type rehabilitation or an applying physical agents to every injury? So again, if a patient doesn't necessarily have this, do we have to necessarily apply ice? So we know that ice can assist with it, but if not all patients are going to develop this, do we necessarily have to do that? So it's just, again, it's just a thought process and a consideration to be examining as we kind of go through the application of cold. So even though it's not related to necessarily injury and rehabilitation, looking at cryotherapy for performance enhancement and recovery, and this is getting looked at more and more. You have the cryo chambers now that people are utilizing to assist in recovery. So they're trying to look at cryotherapy as a way to facilitate recovery just from training in general. So not even necessarily looking at it from an injury perspective, but looking at it from the standpoint of, can we enhance recovery? Because again, the idea behind being physically active, whether training for a sport or exercise, is going, stressing the body, but then allowing your body to recover so that you could then kind of repeat that process. So again, like a lot of things, more evidence is needed. So they found that there's no change in performance after a single treatment per se. However, they didn't look at it necessarily in regards to multiple treatments. So, this could be like everything else where, yeah, if you do it one time, it's probably not going to create a lot of big changes. And the reason why they say that is that when they look at the benefits of this, when they kind of study things like heart rate and inflammatory blood markers, they actually show benefits to using cold as a recovery modality. So when they kind of look at this a little bit deeper and look at these physiologic factors in being able to measure recovery, they have found some benefit. So what we could say is that maybe look more at parameters and cumulative treatments, which isn't that unusual. I mean, typically when you just do something one time, it may not necessarily have a carry with it a great benefit, but if you do something multiple times, it can certainly aid in producing some sort of effect. So your cautions for cryotherapy. So just like everything else, now it's unknown if cold use during the acute inflammatory phase affects healing. So your textbook discusses some of the potential negatives. So we already discussed how the cold's impact on the inflammatory phase of healing. So there is some belief that potentially, now it has not been substantiated, that so say for instance we know that cold causes vasoconstriction. So if you cause vasoconstriction, remember part of the inflammatory process is vasodilation, and we have that vasodilation because we need white blood cells to be able to get out of the circulation and be able to remove debris and kind of prepare the area for the repair phase. So there's some belief that could happen. However, there's no real there's no data that supports that. Now, in general, you do have to ask yourself, if you're applying ice, that you're going to have reduced blood flow to the area, so that can there be a negative effect to that? Again, no definitive evidence, but what we do think does happen is that it does moderate the inflammatory response. So in other words, we know that there are based on the physiologic responses to cold and the inflammatory process, we know that the inflammatory process kind of has some of these, again, negative side effects to it. Okay, by moderating that aspect of it, that's where we kind of limit. And in particular, we look at the reduction in secondary tissue damage. So if you're kind of lowering the metabolism to those tissues, we're kind of reducing that secondary tissue damage that is already going to occur due to the ischemia, which is the lack of blood flow, the hypoxia, the lack of oxygen that's going to be coming into the area due to the fact that you have swelling that's going to kind of limit the blood flow to the area, and also the slowing of blood flow that occurs because of the vasodilation. So, for the most part, with the way we apply cold, so again, cold, the length of application is obviously limited, and while effects do remain, so the effects of cold remain for about 15 to 45 minutes after you remove the cold, but we think that with the, again, limited application, we're not going to necessarily suppress the inflammatory response per se. However, we can moderate the negative effects that occur. So contraindications, so these would be reasons why we would not apply cold to somebody. So again, you always want to make sure that you kind of have a health history of your patients and know what those health concerns are, so that you don't apply cryotherapy in a situation where it shouldn't be. So Raynaud's phenomenon, which is a vasospastic disorder. So an individual with Raynaud's, their kind of vasodilation, vasoconstriction does not respond appropriately to changes in temperature. You could see this. Some people just have an idiopathic Raynaud's where they don't know why it happens, but you see it often in the wintertime, individuals with this. Some people will have Raynaud's secondary to some other condition, so that would be a contraindication for cold. Complex regional pain syndrome, which we talked about in the pain chapter, is a contraindication of cold. People tend to not respond very well, so we know that it's very likely to worsen their problems. So you should not apply cold in somebody who would have that. Cold urticaria, which is an allergic reaction to cold. So this is contraindicated. So usually if somebody has cold urticaria, they can develop an anaphylactic reaction. So hives tend to break out in the area. They'll get really and they'll itch because of the hive formation. So it's another thing. Typically, and again, if it's bad enough, we all know that if someone has a bad enough allergic reaction, we could have respiratory compromise. That usually doesn't happen with cold urticaria, but it can, so it's something to be aware of. Cold-induced hemoglobinuria and cryoglobulinemia. So these are two different conditions. Cold-induced hemoglobinuria is a red blood cell breakdown that will occur in response to cold. Cryoglobulinemia is a clumping of plasma proteins. So these are definitely things that could potentially affect the circulatory system. And patient preference should be considered. So and again, if you truly believe that cold is going to work, but at the same time we have to look at the patient and kind of how they respond to cold. If the patient's that averse to cold, they may not have the response that you're looking for, or it could make them kind of hesitant to carry through with their treatment. So this is just a table. It's in your textbook. Another thing to note are the precautions. So the difference between contraindications and precautions. Contraindications, you cannot apply the modality. Okay, it's contraindicated. Precautions are just something you need to be aware of. There could be the possibility that an adverse effect could happen. So some precautions to look at is application over superficial nerves. So you have to look at things. The median nerve, any type of superficial nerve. The peroneal nerve is a kind of runs behind the back of the lateral knee. So those areas you want to be aware of. You just want to limit your ice application over those areas. So you can apply ice. It's not contraindicated. You just want to make sure you don't leave it on for too long, because you could develop a little bit of a nerve palsy from that. Areas of diminished sensation. Just because, again, if by chance the ice is causing damage to the area, the person won't be able to feel it. Poor local circulation, slow healing wounds if they're medically unstable. Again, you use your judgment in regard to that. If someone is being treated for a condition, it's always best, and you would do this with any patient, is just look at talk to their treating physician. I've done that where I've had situations where I was a little unsure. It wasn't necessarily contraindicated, but it was, kind of a gray area. I would just talk to the treating physician and just say, I'm treating so-and-so for this injury. I noticed that they have this in their health history. Would there be any problem with this? And get some input from the physician. These are your indications: relieve pain, again, control swelling and protect injured tissues when combined with those other means of treatment. And also decrease in muscle spasm. And again, the decrease in muscle spasm is just going to come from that that slowing of the motor input and the decreased sensitivity of the muscle spindles. So your modes of delivery. So I'm going to put all the modes of delivery up here. There's various modes of delivery of cold, and we're going to look at these, and you could use your own judgment in trying to determining. So ice pack is probably the most common thing in most athletic training settings that you will utilize. For a focal and localized area, it's pretty inexpensive. So some individuals also have commercial cold packs. They're fine to use as well. It should be noted that if you're going to use a commercial cold pack, so an actual bag of ice can be applied directly to the area. If you're going to use a commercial cold pack, you have to make sure that you use an insulating layer. So there should be a layer of something between the skin and the ice pack, because there's a much greater risk of tissue injury with a commercial ice pack, okay? And that's because it's basically held to below freezing, and you could possibly cause frostbite if you do not do that. Also, make sure your commercial cold packs, if they have chemicals in them, that they're not leaking, because they can also cause skin damage as well. Ice bags do cool areas better. The reason for that is that you get an actual physical change. So there's actually a greater energy exchange between the body part and the ice bag, because what happens with an ice bag is that the ice turns from a solid to a liquid. So that actually creates a situation where you have a much greater decrease in tissue temperature, as opposed to a commercial gel ice pack, which doesn't change state. Now you'll say, well, when you take it out of the freezer, it's a little harder than when it's on for a while, but it's not changing. It's not going from a solid to a liquid. It's just basically warming up. It's not changing its state. So that's something to kind of note when you're doing that. Cold water immersion. So cold water immersion could be both just a straight ice bath or a cold whirlpool. So for your ice bath, you're looking at a water temperature between 40 and 50 degrees. The whirlpool can be between 50 and 60. And both of those will cool tissue as well as an ice pack, and actually not only will cool as well, but it'll also keep the temperature lower for a longer period of time. So that's something of note. The thing to consider with cold water immersion is if one of your goals is to, in your treatment, is to reduce swelling, you're going to be putting the treatment limb in a gravity dependent position. So while you might get the pain relief from doing it, if you have a large amount of swelling in the area and it has to be gravity dependent, obviously I'm referring to a lower limb here, that's kind of one of the limitations of that. The cold whirlpool doesn't necessarily have to be kept as cold, because since the water's circulating, it's constantly breaking down. There's something that when you stick your foot in cold water, what eventually forms over time is what's called a thermopane. Your textbook talks about this. It's just this little layer that forms between your skin and the water that actually after a while you don't notice the cold as much. And you see that in again, this is just in the straight ice bath, where if the water sits still, you develop that. So if you move the water around, it'll eliminate that. So in a whirlpool, that doesn't happen. So you don't have to have the whirlpool quite as cold, although you notice the temperature ranges are closer. Again, temperature range for an ice bath between 40 and 50. For a cold whirlpool, it will be between 50 and 60 degrees. So that's important to note. Walk-in pools are another form of cold therapy. This would be something you'd be doing if, say, you were doing a full body submersion. You'd be utilizing that. There's various types of garments and pumps that could be used. These are those cold water circulating units. There's a picture in your textbook of one of those types of units. Essentially, what they do is they have various attachments to them that kind of conform to the body part area. So you have like an ankle, you'll have one for the shoulder, and what those units do is they just constantly chill the water and circulate it through. So the water kind of stays at a good temperature, plus the other benefit is that you also get the compression feature with it. So it's both cryotherapy and compression with that. Ice massage is kind of another inexpensive way to kind of cool an area. So if you want to treat focally for a region, particularly for pain reduction, all you're basically doing is taking that ice cup and you're basically rubbing the ice over the area. You can use that to kind of desensitize your trigger points. That's one really good way of doing that. And again, fairly inexpensive and very could be pretty effective for certain areas of the body. Again, for some of these, when you're picking them, some of it is going to be body part dependent. It's also going to be what it is you're trying to do. If you're utilizing ice in the acute phase of an ankle injury, ice massage probably isn't your best bet because you're not combining it with compression, you're not doing some other things. However, if you're maybe using ice massage to reduce trigger points in the upper trap, that could be a much better option for you. Vapocoolant sprays are another one. We kind of showed an example of this. This is when you basically just spray a liquid on the skin, it evaporates, it provides the sensation of decreasing superficial tissue temperature. For the most part, they're pretty safe. However, if you do overspray, again, you could have tissue damage. They're very beneficial in the treatment of myofascial trigger points. So that's a good way you basically use that. So essentially what you do is you would spray the area and combine that with a stretching motion or range of motion. The idea is you're interrupting the ascending neural signaling. So, and what that does is kind of desensitize the person and kind of helps in reducing their pain. Okay, so when we look at application parameters, and we'll certainly get more detailed on this in class as well, but just to give you some ideas. So we look to get a target tissue temperature somewhere in the range of 55 to 60 degrees, and that will kind of create your effects. So your treatment time is going to depend on goals in the treatment area. So at one time, they were basically saying that, 20 minutes every 2 hours. Well, the every 2 hours isn't necessarily a bad idea, but you can't just say 20 minutes because body part regions are a different size. There's going to be some, essentially you're not going to get as much of an effective cooling response if you only ice certain areas of the body for certain periods of time. A lot of the reasons why the 15 to 20 minute time frame was recommended for every area was that they were worried about something called the Hunting response or the Lewis reaction, which your book talks about. And what they described this is the alternating vasoconstriction and vasodilation when exposed to cold. So the worry was that if you keep ice on an individual for too long, is that so you'll get that vasoconstriction, but then the body does this vasodilation, and what that would do is actually worsen the effects of the acute inflammatory response. So what we found, though, is that doesn't necessarily happen. While there is a small amount of vasodilation that does occur, it's not getting the blood vessel back to its or even to its original diameter. So basically, the Hunting response or Lewis reaction is not a concern. And what they found is that you can ice for longer periods of times. So what we want to do is look at, from a practical standpoint, how we want to apply cold. So one of the areas that we can look at is, again, look at the size of the area. So typically for a finger, somewhere around 20 minutes, 30 minutes for an ankle or an arm. If you get into a thigh, you could go up to even 45 minutes. So that's something you want to consider. So it wouldn't make any sense to ice a finger and a thigh, particularly in a larger individual, for the same amount of time. So treating a thigh, you can go up to 45 minutes because you're treating a much larger muscle. You possibly are going to have more adipose tissue in the area, so that's going to be really important. For cryokinetics, again, the benefit here is that you're going to reduce some spasm, help improve active range of motion, also limit that arthrogenic muscle inhibition. Again, clinical judgment whether or not cryokinetics is appropriate or not. So it's really important to kind of note that if you are going to utilize cryokinetics, that you're making sure that it's appropriate for the patient and it's not going to cause any more tissue damage. Another thing, just kind of going back to the issue of treatment time, you also have to consider the type of the type of cold modality you're going to utilize. So for a cold pack or an ice bag, those times that I give you will apply. If you're talking something like a cold whirlpool, an ice immersion, or something of that nature, you're not necessarily going to always utilize those times. Most whirlpool treatments are going to last around 20 minutes when you're dealing with that. Same thing with ice massage. So we'll get more into those when we sort of discuss in lab kind of how we apply those. But essentially look at what you're trying to do with it. Essentially, if you're trying to just reduce pain, technically all you'd have to do with a lot of these is just get them to the point where the area has been anesthetized and you basically accomplished that goal. So those are some things to kind of consider when you're looking at treatment times. Again, those times I gave you in relation to the body parts tend to work really well for both ice bags and commercial cold packs. So again, the other thing to consider is ice always the best option? And you see here in this book that I'm showing, Don't Ice That Ankle Sprain. So, that's probably one of the most ankle sprains are one of the most common injuries that we see. And again, we immediately run to that, ice and compression and elevation, what have you. But, there's actually no evidence in regards to ankle sprains that cryotherapy actually hastens their recovery. So it gives something to think about. Again, I'm not saying don't use ice, but, again, look at all your options out there. Look at what your patient is doing, and kind of come to your clinical decisions as you're kind of working with that. Okay, superficial heat. Again, all of these heating modalities that we're discussing only heat tissue up to a depth of 1 centimeter. So that's important to note. So you're not really getting, you will get an increase in tissue temperature in deeper tissue. However, it will not be to therapeutic values, particularly if you're looking at decreasing the viscosity of the tissue. So there will be some, in the superficial tissue, you will get some of that, but that's not why you're using the superficial heat. You're not actually going to heat deep tissue. Superficial tissues you can. So if you're talking about things like, the wrist, the hand, an elbow possibly, or even a knee in a smaller person, you may get some deeper heating effects. But again, it's going to be limited to more superficial areas. So what are we looking at? Again, it does help in reducing pain. So we know that you get a kind of that soothing relaxation effect. Application after musculoskeletal injury. So it's not advised during the acute inflammatory phase. The idea is because obviously you may possibly exacerbate some of the negative effects of the inflammatory phase if you do apply heat too soon. Again, for the most part, the effects are rather superficial. So chances are if you apply it too early that you're not necessarily going to cause damage. But when you're looking at kind of the science related to, metabolic rate, metabolism in the area, we obviously don't want to raise the metabolism, which you would do with heat, particularly in a superficial area, because of the fact that, there's already going to be, because of what's happening, that area is not going to be getting as much oxygen as it should anyway. So the fear is that you could possibly exacerbate swelling and possibly even exacerbate pain, because you would kind of increase the inflammatory, the negative effects of that inflammatory process. Now, it'll help with pain modulation outside of the inflammatory process, and we believe that this is going to happen due to a couple different effects. The primary pain relief is going to be from those descending pathways, so that level 2 pain control. So that will be one way in which you will more than likely receive pain relief with that. So that's going to be the primary way that we believe that this happens. And again, what you're going to want to look at is the type of pain, and also consider the patient preference. Okay, some patients really do like cold. They do like the application of cold, and they believe that it's better for them. So, just consider that as you're kind of discussing your treatment plan with your patient. Okay, and due to the fact that it will inhibit pain, we know that there is a benefit to pain. It can help in reducing muscle tightness. So that, again, if you're going to limit that pain, you're going to break that pain spasm pain cycle, therefore create that analgesic response that will help reduce the amount of muscle tightness. Healing and loading may help restore functional range of heating and loading may restore functional range of motion. So once you could get to that point where you've kind of gotten out of that acute inflammatory phase, you can start to apply heat because it'll help with tissue elasticity. Typically, you'll get more out of this again from superficial areas. Hand, wrist, foot, and ankle tend to respond very well to this. If you do need more vigorous heating of deeper tissue, there are other modalities that will help with that. So that's where your ultrasound and diathermy would be more effective, because you're not going to get the level of heating you need to truly improve elasticity for tissue, particularly deep tissue. You're not going to get with superficial heat. If you do use superficial heat on like say a big muscle or an area that's a little deeper, again, you'll get a relaxation response that'll help with it, but it won't be that direct tissue temperature increase that improves it. There's limited use available regarding the use to treat arthrogenic muscle inhibition. So we talked about how cold works with arthrogenic muscle inhibition. So if you think about it, it doesn't really make sense to use superficial heat to do this. So again, if you think back to why arthrogenic muscle inhibition is caused, if you apply heat, superficial heat is going to increase conduction velocity and decrease the depolarization threshold of neural tissue. So what that essentially means is you're actually going to be adding, if you're looking at this from a physiologic perspective, you're actually going to be adding to that by doing it. So you would want to utilize something that does inhibit that response in order to limit the arthrogenic muscle inhibition. So it would not be something that would be utilized for that. Application of some commercial products have been shown to help improve sleep quality. So there are certain types of heat wraps. For instance, there's those 8-hour heat wraps that you can get. They have been found to be safe and also help with pain control. So what these tend to do is provide a very low level of heat that again produces that relaxation response and that pain inhibition response that we had talked about with the pain modulation. So these are something that can be used and have been found to be beneficial, and for the most part are relatively safe. So superficial heat, cautions and contraindications. Acute inflammatory state due to increased swelling, we would not want to apply heat. In individuals with coronary artery disease is something else to consider. So if someone has that in regards to superficial heating, that would be a precaution. So if they're medically unstable or have coronary heart disease, that would be a precaution. Another contraindication that you would also see would also be diminished sensation or poor local circulation would be another thing that you would see with superficial heat. Burns, for the most part, if you apply adequate insulation, so we'll go through the process of how you would limit the impact of burns. We'll talk about the layering that you will utilize with your moist hot packs. You want to control your whirlpool and flutotherapy temperatures. So we'll go through the temperatures that you would want to utilize for whirlpool, but if you can, you control those temperatures for the most part, you won't have a problem with burns. One of the areas, particularly with moist hot packs, it's kind of a rule of thumb. Don't put the person on the modality, put the modality on the person. If you're going to have somebody, if for some reason they cannot, you cannot put the person in a position to put the moist hot pack on them. You just have to make sure you provide extra insulation, and we'll kind of go through that process in lab so you can see that. So here's the table, and again, we get into some modality specific. There's also some modality specific indications and contraindications. So if you look at this, you have the general superficial heating, and then you have the modality specific. We'll talk about these three modalities in a second. So these can, whirlpool flutotherapy, which is essentially what we call like a dry whirlpool, and a paraffin bath, which is the melted wax. They're very good for heating superficial joint capsules. So I've used, for instance, paraffin with hand injuries tends to be very well. With both of these, your contraindications also include open wounds for them, so you cannot use open wounds. You can apply flutotherapy with open wounds. You just need to make sure they're covered very well. Okay. Again, your other indications: decreased pain, decreased muscle spasm. You have your contraindications, and then you have your precautions, as we discussed previously. Okay, modes of heat delivery. The moist hot pack is probably your most common type of heat delivery. It's probably the one you'll use most often clinically. Again, we look at 20-minute treatments as being effective for what you need to do for pretty much most of your treatments. One important point with the moist hot pack is make sure that the hydroculator that they're stored in is at 170 degrees, that the water is maintained at that temperature. Warm water immersion. So for warm whirlpools should never exceed 115 degrees. When you're looking as far as temperatures, and this is just what we're going to stick with for the purposes of our discussion. So really what you're looking at for the most part is between 100 and 110 degrees. So we're just going to work with the round numbers. If you're treating a limb, anywhere between 105 to 110. If you're doing a whole body warm water immersion in a warm whirlpool, 100 to 105. Those are the numbers we're going to work with. That's slightly different than what's in your textbook. They're very close, but we'll just kind of keep it to those ranges just to have consistent conversation with what we're talking about. The reason for the difference is the more body surface area that is in a warm whirlpool, the temperature of the warm whirlpool has to be lower. The reason being is your body, the more your body's submerged in it, the less your body can dissipate the heat. So if you just have your ankle in a warm whirlpool, you have the entire rest of your body to kind of dissipate that heat that you're getting from the warm whirlpool. If you're submerged in it up to your neck, you only have basically your head and face to dissipate the heat. So that's why the temperature has to go down as you put more of your body in the warm whirlpool. The opposite is true when you're talking cold water immersion, actually. So the temperature you actually want to increase the more your body is in the cold whirlpool. So it's a little different for both. And again, it's just the amount of body surface area getting submerged and how the body regulates its temperature. Okay, paraffin baths are basically baths filled with a wax and mineral oil combination. Now, this combination is usually heated to 125 to 127 degrees approximately. So water at that temperature would actually burn your skin, but since the paraffin wax has what's called a lower specific heat, it's obviously much more comfortable, and two, it doesn't burn your skin, so you don't get that same thermal exchange. One of the things and this same would go for whirlpool baths, so I'm going to back up just 1 second. You have to make sure whirlpool baths get thoroughly cleansed afterwards. That's a really important point. Make sure they get disinfected. Paraffin baths, you got to really kind of make sure they stay clean as well. So occasionally what'll happen is you'll get some, dead skin will kind of could possibly settle into the paraffin wax. So you have to make sure that you do clean them as well. But basically what you would do is, again, you would, for a paraffin bath, and you could see this illustrated in your book, you basically dip the body part in about 4 or 5 times, each time letting the wax kind of harden around the area. It is kind of limited with what you could really use it for. I've only ever used paraffin baths for hands. I guess theoretically you could use them for feet as well. I just haven't really had a real major purpose for doing that. Again, 20-minute treatment. Once you get the 4 or 5 layers of wax on there, you can then either wrap with like a towel. Some people say you could use an oven mitt. I actually, whenever I've used paraffin, I actually put a hot pack around it too. So just to kind of give a little bit of an extra heating effect. So that's something that you can use. It should be noted that, again, here, one of your contraindications is also going to be open wounds. So if someone has an open wound, they should not be sticking the body part into the paraffin bath. Heat lamps. Your textbook talks about heat lamps. However, you're really probably not going to run into heat lamps all that often. Again, heat lamps can provide the same benefits. They're usually not, number one, they can only be used by one person at a time. I mean, you could put a bunch of hot packs on multiple patients. The other thing, too, is The amount of heating is dependent on the strength of the bulb and how far away the lamp is from the body. The other thing is there also tend to be more of a dry heat, which isn't all that comfortable. Some people debate whether moist heat goes a little bit deeper. I don't really think there's significance as far as the depth of heating, but moist heat is definitely much more comfortable for the patient. And then you have fluidized therapy, or what they call flutotherapy. So flutotherapy is essentially a dry, warm whirlpool. So here you're looking at about 120 to 125 degrees, and what this is circulated air that basically blows around what are essentially ground up corn cobs. So what it is, these little ground up corn cobs, they're ground down to about as fine as what sand would basically feel like, and this is blown around by this heat. Again, similar to a paraffin bath, the temperature could be a little bit warmer because of the lower specific heat, so the thermal exchange doesn't cause the burning. Again, water at 125 degrees, you wouldn't be able to put your hand in because it would hurt. But this is another good type of therapy that can be utilized. Again, hands, feet. Again, there's some limitation. You can't put, it's hard to get a lot of your body surface area inside one of these machines. But you can obviously utilize them for these specific things. The other nice thing about these is that you can do like a lot of good range of motion. So when you're doing something, say with the wrist and hand, you could start to incorporate range of motion. You could have the person. I've used flutotherapy machines before. What I would do is after a while, have the patient, once they kind of get warm, after maybe about 10 minutes or so, I'll start to have them kind of like try to catch and grab the ground up corn in their hands and try to basically accumulate it within their hands, so they start to work on their grip a little bit. Individuals with open wounds can use these, but you must make sure they are dressed appropriately. So you have to make sure there's a good dressing on there to make sure that no contamination can occur. Okay, again, heat application parameters. Again, you're looking to try to get your target tissue to a range of 104 to 113 degrees. Again, for the most part, most of your effects with this are going to be, with all of these treatments, are going to be super. So again, if we want to get deep heat, again, there's going to be other modalities we're going to talk about where that could be utilized. Again, from a treatment time perspective, we're just going to look at 20-minute treatment. For the most part, you're going to get relief of pain and muscle tension with that via whatever mechanism based upon the size of the body part you are treating. Okay, brief discussion about contrast therapy, because I mentioned in the past there's really, for the most part, they haven't found a ton of benefits other than maybe some sensory pain relief, and even the research on that is a little questionable at best. Okay, so essentially, again, you follow your guidelines for cold bath and warm whirlpool. You're usually using a cold to warm ratio of 1 to 3 or 1 to 4. So that's an important point to know. There again, there's no definitive literature on whether to begin, end with cold or heat. So some people say, well, do I begin with cold? Do I begin with heat? There's no definitive literature on it, whether you should start with the heat or the cold. Anytime I've seen it used, or when I was a student and it was used a little bit more, for the most part, we always start it with cold. I don't remember what the rationale behind that was. And again, it's not really all that relevant because there's no real literature on it. Contraindications are based upon cold and heat and any type of water-based treatment. So your contraindications for this are essentially those that apply to both cold and heat, and then any type of water-based treatment contraindications you would want to consider for that. So this is really, so the biggest thing is, if you just know the cold to warm ratio, that's the biggest thing you need to know, beyond the fact that really there's no proven benefits of contrast therapy. So in summary, I'm just going to put all these up here. So this just kind of summarizes everything, and then I'll give you your learning outcomes you can use to kind of review for your exam. So again, always consider contraindications. That's always the first thing whenever you're deciding any type of modality. Again, cold can be used to manage pain and muscle spasms. So again, know what the modalities actually do, okay? Not so much just, again, kind of in, what people think they do. It's important to know that, because again, you're looking to achieve certain goals. Again, make sure that, you know, application and compliance also affect treatment. So you have to consider where the patient's at, you know, what the patient actually likes to a degree. So you have to consider all of that when you're selecting your treatments. And here are your learning outcomes. And these are your learning outcomes in regards to the clinical application. So again, both of the learning outcomes are going to be important to review for the exams. Also, when in regards to the lab practical, the clinical applications can even more specifically assist with that.